clearly visible and audible to you people. So I welcome you all for this session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, a medical entrance educator on Unacademy, and today I am here to continue my pharmacology series. This series is curated specially for FMG students, and today I am going to start a very important portion of pharmacology, that is antimicrobial drugs. So I'm starting with antimicrobial drugs. I will cover all antimicrobial drugs in the next two classes. Today is the first class, and in the next class we will cover it. So Rahul is asking when I am going to take ANS, cholinergic, anticholinergic. Soon I will take. After antimicrobials, my next target is autonomic nervous system only, Rahul. So stay connected. So today I am starting with antimicrobial drugs. You have to give me 1 second. Just 1 second. Just 1 second you have to give me. I will start it. Okay, so here I am starting it. So antimicrobial drugs. So before starting, now there is a special way in which I will teach you all antimicrobial drugs. I ask you to make comparative tables. The comparative tables are also given in my notes. If you don't want to make, it's okay. It is given in my notes. But if you draw by your own, you will never forget. So in those comparative tables, you have to write all drugs, that is sulfonamide, that is trimethoprim, that is quinolones. These will be my first drugs, then tetracycline, then chloramphenicol, then aminoglycoside, then erythromycin. These will be my next 4 drugs. So today I am targeting to teach you these 7 drugs. So all these drugs, I ask you to take a big sheet, to take a notebook and make a comparative table of all these drugs with the introduction of each of them, in which I will tell you the structure and important points regarding the introduction, then classification, then mechanism of action, then uses, then adverse effect. You can give a heading of pharmacokinetics also. In some of them, pharmacokinetics is important and not all of them. If you make this comparative table with me only, now studying pharmacology will be a fun for you. Believe me, I'm going to give you numerous mnemonics from uses and adverse effects. Uses and adverse effects mean mnemonics, 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 mnemonics. Many mnemonics will be there. And in mechanism of action, I will give you flowcharts for all of them. So you don't have to learn anything. You don't have to mug up anything. You just have to understand the things. So let me start it. Are you people with me? Give me a thumbs up. If you people can listen it and enjoy it. Okay, I'm starting it. So before starting drugs one by one, I would like to give you the classification of antimicrobial drugs. How we classify. This is the 6 ways by which we do the classification of all antimicrobial drugs based on chemical structure. Based on their chemical structure, there are 17 types of antimicrobial drugs. I will tell you the name of each of them. These are the 17 types. 1, 2, 3, 4, 5, 6, 7, 8, 9. You can see the 17 or 18 types are there. So based on chemical structure, some of them have sulfur groups in them known as sulfonamides. Some of them are diaminopyranamides. Some of them are quinolones. Some of them have beta-lactam ring like benzene ring. These are known as beta-lactam. Some of them have 4 rings in their structure. That's why known as tetracycline. Some of them have nitrobenzene in their structure. So nitrobenzene. Aminoglycosides have amino and glycide group. Macrolides have big rings. Lincosamide and glycopeptide. Oxalidione, polypeptide and nitrofurantoid. So these are the chemical structures. No need to learn these structures. But based on chemical structure only, today I will take the first 7. Out of the 17, first 7 will be taught by me today. So I am targeting today. Let's see how much we can do. It is a big lecture. So I will start with sulfonamide, my first chapter. Second chapter will be trimethoprim. The third chapter will be quinolones. Fourth chapter will be tetracycline. Fifth chapter will be chloramphenicol. Sixth chapter will be aminoglycoside. And seventh chapter is macrolide. So I will teach you these 7 chapters today in a comparative manner. बीच में मैंने penicillin छोड़ा है, beta lactam. That I am going to cover tomorrow because penicillin is a big topic. It alone will take half of the lecture. So penicillins and continuing with lincosamide or these are small topics I will take tomorrow. So in this way I am going to cover all these 17 groups. That was the first classification based on chemical structure. It is of 17 types. So from that 17, 7 aaj ho jayenge. I will try. Anyways, coming on the second classification based on organism against which these drugs are active. So if it is killing the bacteria, these are known as antibacterial. If they are killing the fungus, these are known as antifungal. They are killing the virus, they are antiviral. Killing the parasites. Parasites are of 2 types, protozoa and helminthic. So antiprotozoal, antihelminthic, both of them are anti-parasite. So we have 4 organisms, bacteria, fungus, virus and parasite. So these are the drugs. We will cover all of them, don't worry. So first let me cover antibiotics. Then I will come on antifungal and antiviral. Antiprotozoal maybe I will not teach you. You can study by your own. It is a small topic and not really important for MCQs. So coming on the third classification. Third classification is based on spectrum. Some of them are broad spectrum, some of them are narrow spectrum. What do you mean by spectrum? Broad spectrum will kill all bacteria, whether it is gram positive, gram negative, cocci or bacilli. If it is broad spectrum, broad spectrum, it will kill all bacteria without any specificity. That's why known as broad spectrum. So broad spectrum will kill all. There are 4 types of bacteria. You have to learn the classification. You should know this portion of microbiology for studying pharmacology. That is the integration, you know. That's why I teach you multiple subjects together to have better integration. You should know gram positive cocci are only 2, strep and strep. You should know gram negative cocci is only 1, Neisseria. Gram positive rods A, B, C, D, L. So actinomycetes, bacillus, clostridium, diphtheria and listeria. You can see A, B, C, D, L. And all others are gram negative rods. So you should learn this basic classification because whenever, one more heading here. I have told you to draw the headings now. So introduction, classification, mechanism of action. After mechanism of action, write spectrum. I will teach you spectrum of all antibiotics. Now you are going to become a doctor. Whenever any patient is coming to your clinic, I am having infection somewhere in the body. So if it is a bacterial infection, there are 2 options. Either you have to give antimicrobial, you have to give antibiotic for killing the bacteria inside the human body. So you have 2 options. Either you will give broad spectrum without any specificity that will kill all bacteria, or you will give narrow spectrum. So narrow spectrum should be specific. If the patient is having gram positive cocci infection, you will give that antimicrobial drug that will kill gram positive cocci only. If it is having gram negative cocci infection, you will give that drug that will kill this. So spectrum of all antibiotic drugs is very important. Although it is boring, but being a doctor, you should know it which antimicrobial drug kills which of the following. There are 4 broad categories. So GPC, you have to learn the name of these categories. You know it is GPC, gram positive cocci, GNC, gram negative cocci, GPB, gram positive bacilli, and GNB, gram negative bacilli. So in all the spectrum, when I will teach you the spectrum, I will show this is having positivity or killing power. It is bactericidal for GPC. So I will not enumerate GPC kya kya hote hain. I am assuming you already know the classification. Yeah, so that is the thing. So you know the classification. So coming ahead, so that is the spectrum. Based on spectrum, it is of 2 types, broad and narrow. Based on chemical structure, it is of 17 types. You know. Based on type of organism, it is antibacterial, antifungal, antiviral, and antiparasitic, antiprotozoal, antihelminthic. So based on the mechanism of action, the most important classification here is mechanism of action. The most important, based on mechanism of action, it is of 4 types. Listen, this is a bacteria cell, I want to kill it. This is the cell of bacteria, this is the cell membrane of the bacteria. Outside the cell membrane, there is cell wall. This is the cell wall. All bacteria have cell wall, whether gram positive or gram negative. Structure is different cell wall, but cell wall is present in all of them. Done. And this is the nucleus of the bacteria. Inside the nucleus, this is the nucleic acid. It can be DNA or RNA. Nucleic acid is present. So this is the structure of a bacteria. I want to kill it. I am a human. This bacteria is inside human body. This is causing infection inside human body, and being a doctor, I want to kill it. So what are the ways I can kill it? What are the ways? Number 1 way, I can give an antibiotic which inhibits cell wall synthesis. Cell wall synthesis. So bacteria will lose the cell wall. Bacteria cannot, ये जो बनी हुई है वो नहीं destroy होगी. New cell wall cannot be synthesized while cell division. While cell division, new cell wall cannot be synthesized. So this is one way of killing. Give me a thumbs up. So cell wall synthesis inhibitors, all penicillins or beta lactams are cell wall synthesis inhibitors. I will tell you which antibiotic works by which mode. Number 1. Number 2, what I can do? I can do the pores or holes in the cell membrane. In the cell membrane, there are some antibiotics which causes holes in the cell membrane. So all the cytoplasm will leak out, all the vitals will leak out, and bacteria will be killed. So they are acting on cell membrane. They are causing pores in the cell membrane. That is the second way of killing it. That is the second way of killing it. So either you inhibit cell wall or you causes pores in the cell membrane. Number 2. Number 3. This is DNA or RNA. So while dividing into 2 daughter cells, this bacteria have to duplicate the nucleic acid, whatever it is, whether DNA or RNA. You give some drugs which inhibit nucleic acid synthesis. So nucleic acid synthesis mat hone do, this cell cannot divide. it will not divide because two daughter cells banane ke liye the nucleic acid has to be duplicated, and if you inhibit the nucleic acid synthesis it cannot divide. So that is the third way of inhibiting it. So the third way is nucleic acid synthesis inhibitors, number 1. Number 3 and number 4, all bacteria synthesize proteins now from nucleic acid. mRNA is formed, that is transcription. This mRNA will come out and act on the ribosome, and from ribosome transcription में से translation होगा and protein will be formed. So there are certain drugs which inhibit protein synthesis. Not two steps can be inhibited, either transcription and translation. Most of them inhibit translation. So protein synthesis inhibitors are there. So again, these bacteria cannot synthesize new protein while dividing, and they cannot divide. Give me a thumbs up. There are 4 ways we can inhibit the growth of a bacteria. There are 4 ways. What are the 4 ways? Who will tell me? Cell wall synthesis inhibitors, cell membrane pores, nucleic acid synthesis inhibitor, and protein synthesis inhibitor. Give me a thumbs up. Everyone give me a thumbs up. One more thing I would like to add here, nucleic acid synthesis inhibitor mein nucleic acid is DNA or RNA. So there are certain antibiotics who directly inhibit nucleic acid synthesis duplication, number 1. And there are certain which do it indirectly. Indirectly means for the synthesis of nucleic acid we require folic acid. So these antibiotics inhibit folic acid synthesis. So folic acid नहीं होगा तो DNA RNA नहीं बनेगा. So these are indirect inhibitors. Everyone give me a thumbs up. So there are 4 ways we want to inhibit the bacteria or kill the bacteria. Inhibit cell wall synthesis, number 1. Causes leakage from the cell membrane. एक cell wall है, एक cell membrane में pores है. दूसरा protein synthesis inhibition, nucleic acid synthesis inhibition. Give me a thumbs up. I want thumbs up from everyone. The same story is given here also in this diagram which I have taught you. You can see the cell wall, you can see the cell membrane, and you can see various mechanism which antibiotic is acting by which mechanism. So learn the name of the antibiotics. The antibiotics which inhibit cell wall synthesis are beta lactams. Especially beta lactams. There are 4 types of beta lactams: penicillin, cephalosporin, monobactam, carbapenem. All of them inhibit cell wall synthesis. Apart from beta lactams, vancomycin, bacitracin, cycloserine, phosphomycin, we will study all of them. All of them have same mechanism. They inhibit cell wall synthesis in a bacteria. Number 1. So number 2, all of them are bactericidal. Bacteria will be killed because cell wall is not synthesized. Number 2, there are certain bacteria which causes holes in the cell membrane, which causes pores in the cell membrane. There are polypeptides. These are polyenes and azoles. Azoles are antifungal drugs. Ketoconazole, fluconazole, itraconazole. So these are the drugs which causes pores in the cell membrane. Which causes pores in the cell membrane. These are the drugs. Number 3, these are also bactericidal. Bacteria will be killed because of the pores. Number 3, there are certain antibiotics which inhibit protein synthesis. So these 4 are important, which we will cover today only. Tetracycline, aminoglycoside, chloramphenicol, and macrolide. So these 4 and these 3 are also there. You can learn them also. So these are protein synthesis inhibitors, and these are bacteriostatic except aminoglycoside. All of them are bacteriostatic. They will not kill bacteria. Only thing, bacteria cannot divide. So these are bacteriostatic. And number 4, number 4, based on nucleic acid synthesis. So some of them inhibit nucleic acid directly, some of them inhibit nucleic acid indirectly by inhibiting folic acid synthesis. So direct में कौन-कौन है? Direct में these are the drugs. Quinolones are there, which we will study today only. Metronidazole and nitrofurantoin is there. So rifampicin is there. All acyclovir, all anti-HIV drugs are there. और indirectly में आपके आ जाएंगे sulfonamides, which we will study today, and trimethoprim. They inhibit folic acid synthesis, and folic acid is required for DNA. So DNA will not be formed. So these are indirect inhibitors. So based on that, you should include this classification in your board and notebook. Many MCQs can be cracked based on the examples only. So cell wall synthesis inhibitor कौन-कौन से हैं? Name them. Cell membrane में pores वाले कौन-कौन से हैं? Name them. Protein synthesis inhibit कौन-कौन से हैं? Name them. Nucleic acid में direct वाले कौन से हैं? Name them. Indirect वाले कौन से हैं? Name them. All your MCQs are based on examples again and again and again. I am telling you. What you people are asking? Let me see. Yes, amphotericin is an antifungal drug, Hussain. Mechanism I will tell you, dream catcher, one by one. Okay, so listen. So I'm coming on the next topic. So that is the mechanism of action of the drug. Classification based on mechanism of action. Classification of antimicrobials based on action. Based on action, whether they are bactericidal or bacteriostatic. What do you mean by bactericidal or bacteriostatic? You see, this is a agar plate. These are the bacterial colonies. If you grow them, they will divide and multiple colonies are formed. If on this plate, you will add few drops of an antibiotic, that is bactericidal. So all the bacteria will be killed and none of them will surviving. So bactericidal kill bacteria. They kill bacteria. And if you put a drop of antibiotic which is not bactericidal, which is bacteriostatic, so count the colonies 1, 2, 3, 4, 5, 6, 7. The same 7 colonies are there only. They cannot divide. They are not killed but they cannot divide. So bactericidal and bacteriostatic. Cidal kills bacteria. Static inhibit them from cell division. Static do not kill them, but inhibit them from cell division. They cannot do cell division. Give me a thumbs up. So bactericidal and bacteriostatic. So you should learn which antimicrobial is bactericidal and which of them are bacteriostatic. I have told you 4 classes now. 4 में से cell wall वाले, all cell wall synthesis inhibitors आपके साइडल हैं. सेल मेम्ब्रेन वाले भी आपके साइडल में ही जाएंगे, लेकिन प्रोटीन सिंथेसिस इनहिबिटर्स और ड्रग्स इनहिबिटिंग डीएनए ये वाले आपके स्टेटिक में आएंगे. सो दैट इज ब्रॉड. यू शुड लर्न इट. And last, antibiotics are obtained from which organism? Some antibiotics are obtained from fungus, some of them are obtained from bacteria, some of them are obtained from actinomycetes. Again, important MCQ, which of them are obtained from fungus? And name the fungus also. Which of them are obtained from bacteria and which of them are obtained from actinomycetes? So you have to learn these 6 classifications. So I am done with classification. I will start chapters now. I will quickly start chapters now. Everyone give me a thumbs up. Everyone. Based on chemical structure, there are 17 classes. Based on organisms on which they particularly act, they are antibiotic, antibacterial, antifungal, antiviral, and anti-parasite. Parasite means it is of 2 types, anti-protozoal or anti-helminthic. Give me a thumbs up. Based on organism, they are killing. Based on spectrum of activity, they are of 2 types, narrow spectrum and broad spectrum. Give me a thumbs up. Based on mechanism of action, they are of 4 types. I'm sorry. They are of 4 types. Number 1, the one which inhibits cell wall synthesis, the one which causes pores in the cell membrane, the one which inhibit protein synthesis, and the one which inhibit nucleic acid synthesis directly or indirectly. That is based on mechanism is most important. Based on type of action, it is of type of action क्या था? Bactericidal and bacteriostatic. Done. And based on antibiotics are obtained from fungus or bacteria or actinomycetes. You should learn this classification. Based on this classification only many MCQs are cracked even if you don't know the individual chapter. Give me a thumbs up. So that is a smart work. Include this classification in your last day notes. Last day में या तो एक जगह compile करो या mark करके रखो तुम्हें क्या पढ़ना है कहाँ से. तो don't revise whole notes in your last 10 days. Last 10 days you have to revise. You can't revise all chapters of antimicrobials in the last 10 days. Now you have to revise only tables which are ultra important. So compile them. Start compiling them. I'm starting with the first chapter, second chapter and third chapter. These are my 3 chapters. My advice to you to make this table. Please everyone take a notebook, take a pen in your vicinity. There may be a notebook, there may be a pen. Please take it. I am advising, I am requesting you to make this table with me. I know I will provide this table. It is available in my notes. I will provide to you. Okay, I will provide to you. But if you make your own now, you will never forget. So the first chapter I am starting with sulfonamide, then cotrimoxazole, that is trimethoprim, and then quinolones. First we will do the comparison of these 3. Then I will take next 4, tetracycline, chloramphenicol, aminoglycoside and erythromycin. Then we will do the comparison of these 4 and compile a table containing all 7. So all 7 together. Or you can make one table only comparing all 7 together. These 3 are nucleic acid synthesis inhibitors and these 4 are protein synthesis inhibitors. I have told you the mechanism now. So first I will teach you nucleic acid wale. Nucleic acid synthesis inhibitor. Indirect wale hain ye sare, direct wale nahi hain. Quinolones direct hai, baki dono indirect hai. And these 4 are protein synthesis inhibitors. So we will see first these. So total 7 drugs. Ye तीनों nucleic acid synthesis inhibitors हैं. Let me tell you, sulfonamide, trimethoprim or cotrimoxazole, whatever you say, and quinolones. So please make a table, introduction, classification, spectrum, whether they kill gram positive, gram negative, cocci or bacilli, or whether they are narrow spectrum, whether they are broad spectrum. Mechanism of action of each of them, resistance and adverse effects. I will tell you mnemonic for all of them. Don't worry. And uses, I will try to give you mnemonics for adverse effect and uses as much as I can. Let me start the first chapter. This is a unique way. No one will teach you in this such a simplicity, the complicated topic. I'm starting with the first chapter, sulfonamide. Okay, so start writing an introduction. Please fill this table. Introduction, sulfonamides are known as sulfonamides because they have sulfa amino group. Sulfa amino group at at carbon number 4. 4 पे MCQ आ सकता है. So this is a benzene ring. I'm sorry, not carbon number 4. Carbon number 1 पे sulfur amino group is there. So carbon number 1 पे in a benzene ring, carbon number 1 have this group. So that is sulfur amino group number 1. And we never use sulfonamide alone. We use sulfonamide along with trimethoprim, and the combination is known as cotrimazole. Cotrimazole. Moxazole. You know the spelling. Maybe wrong. Done. So sulfonamide plus trimethoprim is known as cotrimazole. Initially, we used sulfonamide alone only, but whenever we use sulfonamide alone, we got a big resistance of the bacteria against this drug. That's why nowadays we never use sulfonamide alone. We always use it with trimethoprim, and the combination is known as cotrimazole. Give me a thumbs up. Give me a thumbs up. So here I have written it is used in combination with trimethoprim. It is known as cotrimazole, or sometimes in combination with pyrimethamine for malaria. So that is the thing. So classification. Next heading is classification. It is divided into 4 classes. Please learn. Please learn classification. Short acting, intermediate acting, long acting, and topical. Special means topical. Topical for eye drops. Topical. You have to learn classification. Please, there is no skip. Short acting only one drug, sulfa diazine. Intermediate sulfa methoxazole. sulfa तो सब में आएगा. ये डायजिन है, ये मेथोक्साजोल है. लॉन्ग एक्टिंग में 2 ड्रग्स है, सल्फा डॉक्सिन. ये डायजिन था, ये डॉक्सिन है. और सल्फा मेथोपैरामिन. टॉपिकल में सल्फा एसिटामाइड, सल्फा सालाजिन, सल्फा silver sulfasalazine AG, and mefenide. So you have to learn the classification. I don't know how. So what are short acting? You tell me. Short acting, intermediate acting, long acting, topical, and RA and ulcerative colitis के लिए अलग you can say. So short acting में there are 4 drugs. वहां पे सिर्फ एक ही दी थी. You have to learn all 4. sulfadiazine, sulfasozole, क्या पढ़ेंगे इसको? sulfasoxazole, sulfamethoxazole, and sulfacysteine. These are short acting. Intermediate acting only one. Learn only one. sulfamethoxazole. Long with doxin. ये डायजिन था, ये डॉक्सिन है. और sulfamethoparamine. ये methoxazole था, ये methoparamin है. कैसे लर्न करोगे? I don't know, but you have to learn. sulfacetamide टॉपिकल में है, मेफेनाइड है, और सिल्वर सल्फाडायजिन है. सिल्वर सल्फाडायजिन जो था वो शॉर्ट था, उसी में सिल्वर लगा दोगे तो वो टॉपिकल बन जाएगा. Give me a thumbs up. I tried hard to make you understand कि तुम्हें लर्न न करना पड़े, ऐसे ही याद हो जाए. At least looking at the option, you should identify whether it is short, intermediate, and long, because many MCQs are asked based on classification, which I am going to launch in the form of the polls. After each antibiotic, I will launch polls. So that is the classification. I hope classification you have learned. Coming on spectrum. So don't learn the spectrum. These are the bacteria against which this what we are studying, sulfonamides. Sulfonamides are acting more against Streptococcus, Haemophilus, Campylobacter, and Vibrio. These are the 4 bacteria against which it is highly active, and these are the bacteria against which it is less active. So it is not really important. You can skip this portion. Mechanism of action. Next heading. How it is killing the bacteria. Okay, I will tell you how it is killing the bacteria. This is the cell of the bacteria. This is the cell membrane. This is the cell wall. This is the nucleus, and nucleus contains DNA. DNA is made up of 4 things. What are the 4 things? Adenine, guanine, thymidine, and cytosine. Thymidine, for the formation of thymidine, for the synthesis of thymidine, folic acid is required. Folic acid is required for synthesis of thymidine. If folic acid is present, then only thymidine is synthesized. If thymidine is present, then only DNA will be synthesized. Done. So if this bacteria is present inside my body, I want to kill this bacteria. I will take a tablet of sulfonamide. Any of the sulfonamide, short, intermediate, long, whatever. So sulfonamide will go inside my body. It will be absorbed. It will go in my blood. From the blood, it will go to the bacteria. This is sulfonamide. So this is my tablet sulfonamide. It is entering inside the bacteria. It is entering inside the cytoplasm. Inside the cytoplasm, it inhibits folic acid synthesis. Folic acid will be absent. So thymidine cannot be synthesized. So DNA cannot be synthesized. So I can say sulfonamide is indirect DNA inhibitor. Indirect, not direct. Indirect DNA synthesis inhibitor. So this bacteria will be killed. It cannot survive. Now the thing is how this sulfonamide is inhibiting folic acid synthesis. Folic acid synthesis requires 2 steps. Folic acid is synthesized from PABA. You know the full form of PABA. What is PABA? PABA is para-amino-benzoic acid. PABA PABA. Para-amino-benzoic acid से बनता है डाई हाइड्रोफोलिक एसिड DHFA, और डाई हाइड्रोफोलिक एसिड से बनता है टेट्राहाइड्रोफोलिक एसिड THFA. This tetrahydrofolic acid is required for thymidine synthesis. Thymidine synthesis in DNA, and thymidine is required for DNA. So this THFA, so two steps are there. PABA से DFHA बनेगा और DFHA से TFHA. You know the full form? Dihydrofolic acid, tetrahydrofolic acid, and this tetrahydrofolic acid is required for DNA. So basically what is happening? Two enzymes are required. Folate synthesis for the first step, and what is the name of the other enzyme? Dihydrofolate reductase. So folate synthesis, dihydrofolate reductase. These are the two enzymes required. Now I'm teaching you three chapters now. The first chapter is sulfonamide. Sulfonamide inhibit the first enzyme. So PABA से DHFA will not be formed. If DFHA is not formed, THFA will not be formed. THFA is not formed, thymidine will not be formed. Thymidine will not be formed, DNA will not be formed. Bacteria will be killed. And the second chapter, trimethoprim inhibits the second. That's why we use the two in combination, and that is known as cotrimoxazole. Give me a thumbs up. I tried hard. Cotrimoxazole. Give me a thumbs up. Everyone, give me a thumbs up. I told you the mechanism of action of two drugs together. Should I draw the bacteria again, or have you got it? This is the bacteria. This is the cell membrane, this is the cell wall, this is the nucleus. Inside the nucleus, this is the DNA. DNA contains four things. What are the four things? Adenine, guanine, cytosine, and thymidine. For the synthesis of thymidine, we require folic acid. Folic acid is made up of PABA. So PABA से बनता है folic acid. कैसे? PABA से पहले DHFA बनेगा और DHFA से बनेगा folic acid. That is THFA. Folic acid is basically THFA. This THFA is required for thymidine synthesis. So if I want to kill this bacteria, I will give sulfonamide tablet. That tablet will go in my blood. That will go in the cytoplasm of this bacteria. That will inhibit the enzyme required for conversion of PABA to DHFA. The name of the enzyme is folate synthetase. So folate synthetase is inhibited. So PABA cannot be converted into DHFA. DHFA होगा ही नहीं तो THFA नहीं होगा. THFA नहीं होगा तो thymidine नहीं होगा. Thymidine नहीं होगा तो DNA नहीं होगा. DNA नहीं होगा तो bacteria मर जाएगा. It is bactericidal. Give me a thumbs up. I tried hard. One more thing, the next drug is trimethoprim. So trimethoprim is inhibiting the next enzyme, that is DHFR. So that is dihydro. You have to learn the name of the enzyme. And both of them are used in combination because they are acting at two subsequent steps. So better activity will be there. If we use any one of them alone. So if I use only sulfonamide, only first enzyme will be inhibited. If I use only trimethoprim, only second enzyme will be inhibited. But if I use them in combination, both will be inhibited and I will get a better result. Give me a thumbs up. Give me a thumbs up. Everyone give me a thumbs up. I tried hard. And how this is a cell of bacteria. One more thing I would like to tell you. This is a cell of bacteria. This is the nucleus. This is the DNA. And this is the thymidine, which is made up of PABA. This is PABA. Just suppose this is a molecule of PABA and it will get converted into DHFA and it will get converted into THFA and THFA will form the thymidine. Listen, this is my drug, sulfonamide. This is entering inside the bacterial cell. This is sulfonamide. Listen what I want to say. This is the enzyme folate synthetase. Normally folate synthetase act on PABA. PABA is the substrate and convert it into DHFA. DHFA is the product. For this enzyme, what is the substrate? What is the product? It can identify its substrate. So actually sulfonamide is having similar structure that of PABA. So sulfonamide will say folate synthetase that I am PABA only, combine with me. So इसको बेवकूफ बनाएगा. So as soon as folate synthetase will combine with sulfonamide, it will come to know no, it is not PABA and it will be blocked. So I can say sulfonamide is the competitive. It is doing the competition na for folate synthetase. Competitive inhibitor of folate synthetase. Give me a thumbs up. It is a competitive inhibitor of folate synthetase. Everyone give me a thumbs up. So that is the whole thing. It is written in front of you. You can read by your own. So folate synthetase is inhibited because this is structurally, the drug is structurally similar to PABA and they compete with PABA for binding on folate synthetase. Folate synthesis is inhibited, folic acid is not formed, so DNA is not formed, thymidine is not formed. Give me a thumbs up. The same thing is given here. PABA got converted into DHFA, DHFA got converted into THFA, THFA converted into DNA, thymidine not DNA. So during this, two enzymes are required, folate acid synthetase and DHFR, dihydrofolate reductase. The first enzyme is inhibited by sulfonamides, the second enzyme is inhibited by trimethoprim. Give me a thumbs up. And the combination of the two is known as cotrimoxazole. Everyone give me a thumbs up, everyone. So coming on the next heading, adverse effects. Adverse effect, I am having a mnemonic for you. ABC of fresh. A stands for aplastic anemia. B stands for bilirubin displacement in the brain. The bilirubin is displaced in the blood and the free bilirubin will go in the brain. It will bind with basal ganglion and causes kernicterus. So B for kernicterus. B से bilirubin displacement याद आना चाहिए और उससे याद आना चाहिए kernicterus. अगर नहीं याद आता है तो B हटा के यहाँ पे K लगा दो. K, B is for kernicterus. C is for crystalluria. ABC का C is crystalluria. R for rash, that is allergy. Allergy is a side effect of all antibiotics. That is rash, hypersensitivity, allergy, type 1 reaction. Hypersensitivity reaction. A is for acetylation. This is a drug which is metabolized by acetylation. Those who have attended my previous lectures of general pharmacology, they know acetylation ka mnemonic. What was the mnemonic? CHIPS. CHIPS ABC. You know CHIPS ABC. CHIPS ka jo S hai, that is sulfonamide. Go and check. So this is how you have to connect the things. So that is acetylation. Have you got it? S for SLE. Rash ka S is SLE. And H for hemolysis and G6PD deficiency. Say the full form again. I will help you. ABC of rash. Say the full form. Say the full form. Mnemonic is not important. Its full form is important. Please understand it. So today, अपने roommate को पकड़ो, अपने batchmate को पकड़ो, उसको ये सुना दो पूरा, एक दो बार बोल लो. Say it again and again, or write it again and again. You will fit it in your permanent memory. So A. What does A stands for? I just forgot. What does A stands for? A stands for, yes, anyone? What does A stands for? A stands for aplastic anemia. Okay, let me see. Aplastic anemia. Okay, I will try again. I will try again. So ABC of rash. That is the mnemonic. So A stands for aplastic anemia. B stands for bilirubin displacement. That is kernicterus. C stands for crystalluria. R for rash. A for acetylation is not a side effect. Actually, the drug is metabolized by acetylation. You can learn this. And S for SLE, and H, what was the hemolysis and G6PD deficiency. So these are the adverse effects. So you should learn like this. Kernicterus is important among them. So the free bilirubin, the drug displaces bilirubin. So normally when this is a blood vessel, inside the blood vessel, this is the molecule of bilirubin. Normally it binds with albumin. In the blood, it is present with albumin. Whenever I take a tablet of sulfonamide, this is the sulfonamide. This sulfonamide displaces bilirubin from the albumin. So this itself will bind with the bilirubin. I'm sorry, this is the drug. Okay. So, okay, no. So this is the drug. So it will come, this is the sulfonamide, it will bind with the albumin and the bilirubin will be free. So this free bilirubin will go in the brain and it will bind with the basal ganglion and it will cause kernicterus. Severe jaundice. Give me a thumbs up. Give me a thumbs up. That is the thing. So crystalluria, the drug will precipitate in urine, known as crystalluria. Rash can be there, hypersensitivity, G6PD, hemolysis can be there. Coming on uses. So in uses, alone it cannot be used. It is never used alone. It is used either with trimethoprim, that is known as cotrimoxazole, or it is used with pyrimethamine. It is used in combination. It is never used alone. I am talking about sulfonamides. Sulfonamides either used with trimethoprim or used with pyrimethamine. With pyrimethamine, it is used only for two purposes: malaria and toxoplasmosis. MT, malaria and toxoplasmosis. With trimethoprim, the combination of the two, that is sulfonamide plus trimethoprim, is equal to cotrimoxazole. The brand name of cotrimoxazole is known as Septron. The mnemonic is Septron only. So I will give you a mnemonic again. The mnemonic is Septron. Can you see the mnemonic is Septron? S stands for STDs. It is given for STDs, chancroid and LGV. E for enteritis. Enteritis means diarrhea. It is given for E. coli and Shigella, diarrhea, dysentery. P stands for pneumocystis, fungus. Pneumocystis carini, pneumocystis jejuni. T stands for typhoid. R stands for respiratory tract infections. A for acute UTI. N for nocardia. Have you got it? Let me summarize. This was the first chapter. We are done with the first chapter. We have to be fast, huh? The first chapter is in front of you. Everyone give me a thumbs up. I have really tried hard. And I have done a lots of hard work or homework, you can say, before taking this lecture. I have framed this tables for you. That's why इतना जल्दी जल्दी इसलिए हो रहा है कि पहले का काम पूरा मैंने करके रखा है तुम्हारे लिए. That's why I can teach you in a fast way. Say yes or no. Have you got it? So tell me the first chapter. Who will help me in revising the first chapter? First chapter is done. Sulfonamide. Now I will start second chapter. First chapter introduction. Sulfonamide is known as sulfonamide because it is the sulfonamide group at carbon number 1 of the benzene. Classification. Who will help me in classification? Short acting, intermediate acting, long acting, topical. You know the drugs from inside. You should know the drugs. Coming on spectrum. स्पेक्ट्रम में 4 बैक्टीरिया लर्न कर लो जिसके लिए हाईली एक्टिव है, लेस सेंसिटिव छोड़ सकते हो. मैकेनिज्म ऑफ एक्शन इन वन वर्ड, इट इनहिबिट्स द एंजाइम. द नेम ऑफ द एंजाइम इज फोलेट सिंथेटेज. So PABA will not get converted into folic acid, and folic acid is not formed, so DNA will not form. So in short, it inhibits DNA synthesis indirectly. So that is the mechanism of action. Resistance you can skip. Adverse effect ABC of rash. You know the full form. Should I repeat, or you know the full form? Users may it is not used alone. In combination with the trimethoprim, the next drug. In combination with trimethoprim, the use is Septron. You know the full form of Septron? S for STD, E for enteritis, P for Pneumocystis carinii and Pneumocystis jejuni, T for typhoid, R for respiratory tract infection, A for acute UTI. इसको U बना लो यहाँ तो UTI, और N for nocardia. Give me a thumbs up. So these are the uses in combination with trimethoprim, and in combination with pyrimethamine for malaria and toxoplasmosis. You can write MT also here. I advise you to write Septron and MT both mnemonics. I am done with the first chapter. Everyone give me a thumbs up. So I will move on the second chapter, trimethoprim. Give me a thumbs up. So I'm moving. So before that, you want the poll? Say yes or no. If you want the poll, I want the answer. I want the answer. सिर्फ poll launch करने से कुछ नहीं होगा. You have to write the answer in the chat box. So this is the first question in front of you. Please write down. Longest acting sulfonamides. So the options are in front of you. Who will tell me the answer? Longest acting. So based on classification, sulfadiazine की सल्फाडोक्सिन, डायजिन की डॉक्सिन की सल्फामेथोक्साजोल की सल्फामेथिजोल. Who will tell me what is the correct answer? The four options are in front of you. The four options are in front of you. I will wait for few seconds because there is a delay for few seconds in casting. You know, whenever I cast from here, after few seconds it is reaching to you. So there is a little bit delay. So I will wait. Okay, okay, Khushi. I hope you are right. I guess you are right. Let me check. Anyone else apart from Khushi want to tell me the correct answer? Yes, you all are right. Everyone is saying B is the correct. So diazin is short acting. Doxin is long acting. Methoxazole is intermediate acting. And methiazole is again, I guess, short acting. So long acting among them is doxin, not diazin. So you all are right. The correct answer here is B, na? B ki C. B hai na? Why you are saying C? C क्यों बोला? Nancy, Chet, Diksha is saying D. So no, C and D is not the correct answer. You have to learn the classification. Diksha, Nancy. The correct answer here is B. Doxin. Doxin is long. Huh? Check the classification. Mechanism of action of sulfonamide. The next question is in front of you. Mechanism of action of sulfonamide. Who will tell me the correct answer? Fast. You have to be fast. Read the four options are in front of you. Is it inhibiting cell wall synthesis? Is it inhibiting translocation of mRNA? Is it inhibiting folate synthesis in the bacteria, or is it inhibiting bacterial respiration? What it is inhibiting? So you all are right. Very good. The correct answer here is C. Yes, it inhibits folate synthesis. Very good. The correct answer here is C. You all are right. Yes, Khushi, you are right. And first, Richard, you all are right. The correct answer here is C. Everyone is right. This is the next question in front of you. Be fast. Huh? Okay.
మీరు మీ పర్ఫెక్ట్ లైఫ్ పార్ట్నర్ని చూస్ చేసుకోవాలి అనుకుంటున్నారా? కానీ మీ నంబర్ అండ్ పర్సనల్ డీటెయిల్స్ మ్యాట్రిమోనియల్ ప్లాట్ఫామ్లో షేర్ చేయడానికి సంకోచిస్తున్నారా?
జీవన్సాథీ.com డౌన్లోడ్ చేయండి. మీ నంబర్ ప్రైవేట్గా ఉంచి ఫ్రీగా చాట్ చేయండి.
Here it is. Okay, I'm sorry. This is the next question in front of you. Be fast. Sulfonamide injection causes decrease in folic acid. Whenever I give sulfonamide injection to a patient, folic acid synthesis is decreased by what mechanism? Tell me the mechanism, exact mechanism. Whether it is due to competitive inhibition or non-competitive inhibition or uncompetitive inhibition or allosteric inhibition. What is the mechanism by which sulfonamide decreases folic acid? Yes, you all are right. It is competitive inhibition. Competition with what? Bhuvi, Rahul, Richard. Competition with what? Competitive inhibition to sahi hai answer. With what? Patel? Yes. Competition with what? Competition with PABA. So it is a competitive inhibitor of PABA for folate synthetase enzyme. So the answer is right. The answer is A. Yes, you all are right. This is the next question in front of you. Thymidine is responsible for resistance to which antibiotic? So it is an indirect question. Indirect question. Thymidine, you know the four things are there. Adenine, guanine, cytosine and thymidine. Thymidine is responsible for resistance of which antibiotic? Resistance of which antibiotic? So you all are right. The correct answer here is sulfonamide only. So let me explain you this question. So this is a cell of bacteria. Let me draw a cell of bacteria. This is a cell of bacteria. This is the nucleus. This is the DNA. DNA is made up of four things. Let me draw the four things. The four things is adenine, guanine, cytosine and thymidine. For the synthesis of this thymidine, we require folic acid. Folic acid. If I am giving a tablet of sulfonamide, this sulfonamide is going and inhibiting folic acid synthesis. So inhibiting thymidine. So DNA cannot be formed and bacteria will die. To overcome it, if we separately give thymidine to this bacteria, along with sulfonamide, I am giving thymidine also. तो थायमिडिन डायरेक्टली तुमने बाहर से दे दिया तो थायमिडिन सल्फोनामाइड ने इनहिबिट किया बट यू आर गिविंग इट डायरेक्टली सो बैक्टीरियल सेल विल नॉट डाई and it is a mechanism of resistance, you can say. Thymidine is responsible. So bacteria will learn to synthesize thymidine by some other mechanism. That is the way of resistance. That is the thing. So correct answer here is B. That is the meaning. So correct answer here is B. Have you got it? This is the next question in front of you. Be fast. All of the following are used topically except topical. I have told you 4 classification: short acting, intermediate acting, long acting and topical. Topical कौन कौन से हैं? Except पूछा है क्वेश्चन में. The question contains except. Sulfacetamide, sulfadiazine, silver sulfadiazine and mapinide. You all are right. Sulfadiazine is a short acting और उसी में जब सिल्वर लगा देंगे तो it become topical. So acetamide is topical. Yes, silver sulfadiazine is topical and mapinide, but sulfadiazine is short acting. इसमें सिल्वर लगाएंगे तो topical बनेगा. So except is asked. So correct answer here is B. You all are right. Very good, very good. So this is the next question in front of you. Here except is not asked. Which of the following is a topical sulfonamide? Which of the following is a topical sulfonamide? Be fast, हाँ. टॉपिकल कौन सा है? एक ही है इनमें से. सल्फाडॉक्सिन की मेफेनाइड की सल्फामेथोपायराजिन. तो डॉक्सिन इज लॉन्ग एक्टिंग, सल्फामेथोपायराजिन is short acting, I guess. Mapinide is topical. So correct answer here is B. Again, you all are right. Very good, very good. I don't have time to appreciate your names, huh? You all are right. Very good. Those who have done it right, well done, well done. All of you, I can see your names, but you know it is a long list. I cannot announce the names every time. Okay. If you have any doubt, please write in the chat box. I have one eye on the chat box. I have to see the chat box on my mobile, you know. So it takes time. Okay. Which of the following is a side effect of sulfonamide? I'm asking about the adverse effect. You know the mnemonic. The mnemonic is ABC rash. Now apply this mnemonic and see which of the following is fitting in this mnemonic. Which of the following is a side effect of sulfonamide? If you know the mnemonic, you can apply it. So yes, you all are right. Crystalluria. C stands for crystalluria. So the correct answer here is C. C stands for crystalluria. Very good. So that is how you can crack the MCQs if you know the mnemonic. Next question is in front of you. Very fast. Be fast. In unconjugated hyperbilirubinemia, the kernicterus increases with the use of which antibiotic? Which of the following antibiotic causes kernicterus as a side effect? So the mnemonic of sulfonamide is ABC rash. Here B stands for bilirubin displacement. Bilirubin displacement means kernicterus. I told you कि B से K यहाँ लाना चाहिए. अगर नहीं आता तो K अलग से लगा लो. Done. So B, bilirubin displacement leads to kernicterus. So the answer is sulfonamide. You all are right. The correct answer here is D. That is causing kernicterus as a side effect. So these are the questions from your previous past year exams from chapter number 1. I'm coming on the second chapter, trimethoprim. Coming on the second chapter, trimethoprim. Trimethoprim is never used alone. It is used along with the sulfomethoxazole. Sulfomethoxazole, the combination is known as cotrimazole. Sulfomethoxazole is intermediate acting. Listen, I have told you the classification: short, intermediate, long and topical. उसमें intermediate में सिर्फ एक ही था, sulfomethoxazole, और वो intermediate वाला अभी combined with trimethoprim and the combination is known as cotri. We cannot combine any of them with the trimethoprim. With trimethoprim, we are combining only intermediate wala. Intermediate, the T half of the two should match, na? So we are combining intermediate acting sulfonamide with trimethoprim and the combination is known as cotrimazole or the combination also known as Septran. Again I am repeating. Sulfonamide is combined with trimethoprim and the combination is known as cotrimazole. Cotrimazole or it is known as Septran. One and the same thing. And sulfonamide कौन सा? Intermediate वाला. कौन सा? Sulfomethoxazole. You have to be specific. Give me a thumbs up. There is no classification of this drug because it is a single drug. Trimethoprim का कोई classification नहीं है. It is not a class. It is a single drug. तो classification skip करो. Now in what concentration you will mix the two? In what concentration you will mix sulfomethoxazole with trimethoprim? Sulfomethoxazole and trimethoprim, in what concentration you will mix? You will mix in 5:1. In 5:1. 5 parts of sulfomethoxazole you will mix with 1 part of trimethoprim. Learn this ratio. Learn this. After you will take a tablet contains 5 milligram of this and 1 milligram of this, total 6 milligram. I take a tablet of cotri. I'm taking a tablet of cotri. It contains 5 this, 1 this. After going in blood, this will become 20:1. This will you will say, ma'am, how You are giving 5:1. After going in blood, how it will become 20:1? Because of difference in volume of distribution. You know what is volume of distribution. So because of trimethoprim has a larger volume of distribution as compared to sulfomethoxazole. So it contains a lower plasma concentration, and after going in blood, the concentration will become 20:1. So you are giving in concentration 5:1, and after going in blood, it will become 20:1. An important point you have to note in the introduction. So इंट्रोडक्शन में लिखो, कॉम्बिनेशन लिखो, कॉम्बिनेशन में ये लिखो कि कौन सा सल्फोनामाइड यू आर कंबाइनिंग, द इंटरमीडिएट वाला, नेम इट सल्फोमेथोक्साजोल. रेशियो लिखो 5:1 में देते हैं, ब्लड में जाके 20:1 होता है. ऐसा क्यों होता है? बिकॉज डिफरेंस इन VOD, वॉल्यूम ऑफ डिस्ट्रीब्यूशन. गिव मी अ थम्स अप, गिव मी अ थम्स अप. And when we combine the two together, the action is synergistic. So alone, if I am giving sulfomethoxazole, it is killing 5 bacteria. Alone, I am giving trimethoprim, it is killing 5 bacteria. But together, if I am giving cotri, it will give 20 bacteria. So 5 plus 5, 10, 10 से भी ज़्यादा effect मिलेगा. That is synergistic action. Have you got it? Have you got it? Coming on the spectrum. Spectrum, it is a long list of bacteria. I'm sorry, what has happened? Give me 1 minute. I can't see your chat. Okay, let me try. Okay, I hope I'm clearly visible to you. I hope now. Okay, okay. So this is a long list of the bacteria. Skip it, skip it, just skip it. Mechanism of action you already know. Trimethoprim inhibit dihydrofolate reductase. Dihydrofolate reductase. So DHFA, dihydrofolic acid, cannot convert it into tetrahydrofolic acid. So folic acid is not formed. So thymidine is not formed. So DNA is not formed. So ultimately DNA is not formed. So these are the two antimicrobials which are inhibiting two sequential steps in the formation of TFHA. So DHFR is inhibiting. So enzyme is different. You know, enzyme is different. Sulfonamide is inhibiting folate synthetase, and trimethoprim is inhibiting dihydrofolate reductase. So the name of the enzyme is different. Ultimately, this step is inhibited or this step is inhibited. Ultimately, folic acid is not formed and DNA is not formed because thymidine is not formed. Give me a thumbs up. Adverse effect, I don't have mnemonic for this adverse effect. Adverse effect, इसकी तुम्हें learn ही करने पड़ेंगे. Megaloblastic anemia due to folate deficiency. Number 1, bone marrow toxicity causing pancytopenia, hyperkalemia and teratogenic. Teratogenic can't give in a pregnancy. So these are the 4 important. Nausea, vomiting, the non-specific. These are the 4 specific side effects. Uses you already know, Septron, because we give it in combination. Na? So this Septron is the mnemonic for sulfonamide also and for trimethoprim also, because we give them in combination and the combination is known as Septron. So Septron is the name, same mnemonic. So S for STD, E for enteritis, P for pneumocystis carinii and jejuni, T for typhoid, R for RTI, A for UTI, and N for nocardia. Give me a thumbs up. Give me a thumbs up. So why we combine with sulfomethoxazole only, not with others? Because the T half of both is same. Give me a thumbs up, everyone. The T half of both is same. If we give individual of them, if I give individual sulfonamide or individual trimethoprim, they are bacteriostatic. It is bacteriostatic. It is bacteriostatic. But if I give the combination is bactericidal. Again, important MCQ. The combination is bactericidal. Individual of them is bacteriostatic, because both of them are blocking sequential steps in the synthesis of folic acid. We give them in 5:1, but after going in blood, they will become 20:1. Give me a thumbs up. Give me a thumbs up. Everyone, so this is the second chapter. I'm done with second chapter. Everyone give me a thumbs up. Second chapter is in front of you. What points are important in introduction? Please write it down. So in what concentration I'm giving them? In tablet, 5:1. After going in blood, what is the concentration? 20:1. Why the change in concentration? Because of difference in volume of distribution. Volume of distribution of trimethoprim is more as compared to sulfonamide. That's why its concentration become less and sulfonamide concentration is more. So you should know what is the exact mechanism, and the combination is synergistic. So individual, if you give them, it is bacteriostatic, but the combination is bactericidal. Done. Classification है ही नहीं इसका, because it is a single drug. Spectrum you can learn or you can skip. Mechanism of action, it is inhibiting another enzyme known as dihydrofolate reductase. Compare the name of the enzyme. So both of these enzymes are required for folic acid synthesis. अल्टीमेटली ये इनहिबिटो या ये इनहिबिटो, फॉलिक एसिड नहीं बनेगा, फॉलिक एसिड नहीं बनेगा तो डीएनए नहीं बनेगा. रेजिस्टेंस यू कैन स्किप. एडवर्स इफेक्ट, वहां पे तो निमोनिक था, एबीसी ऑफ रैश, यहाँ पे निमोनिक नहीं है. सो देयर इज मेगालोब्लास्टिक एनीमिया, पैनसाइटोपिनिया और क्या था, टेराटोजेनिक एंड हाइपरकैलेमिया. यू हैव टू लर्न. सो पैनसाइटोपिनिया, मेगालोब्लास्टिक एनीमिया, हाइपरकैलेमिया, और व्हाट इज द लास्ट वन? You have to learn it. Teratogenic. You can't give it in pregnancy. Uses the same Septron, because the Septron It is for the combination of the two. We always use together in the form of cautery. Give me a thumbs up. I really tried hard. Huh? You should thank me for that. So coming on the third chapter, quinolones, last chapter, coming on the third chapter, quinolones. See the time. I have to be fast. Huh? So coming on the third chapter, quinolones. Before that, I would like to launch polls on the second chapter. Are you people ready for the polls? So this is the first question in front of you. Be fast. Be fast. I'm asking the ratio in which they are combined. In cautery, the two are combined. Sulfomethoxazole and trimethoprim are combined in what ratio? Tell me the ratio in the tablet of a cautery. How much sulfo and how much how much trimethoprim? So give me the answer. The four options are in front of you. 2 is to 1, 1 is to 1, 5 is to 1 and 1 is to 5. What is the correct answer? Who will tell me the correct answer first? So you all are right. Okay. So Bhuvi, Patel, Khushi, Richard, Chat, you all are right. The correct answer here is C. Everyone knows the correct answer here is C. It is combined in 5 is to 1, but after going in blood, it is 20 is to 1. The question was more useful if one of the option was 20 is to 1. तो confusion होता तुम्हें. तो it is not asked in blood. It is asked in tablet. तो answer 5 is to 1 होगा. So you have to see question में पूछा क्या है. The correct answer here is C. Done. This is the next question. What is the mechanism of action of trimethoprim? The four options are in front of you. Tell me the mechanism of action of trimethoprim. Is it inhibiting dihydrofolate reductase? Is it inhibiting protein synthesis inhibition? It is inhibiting cell wall synthesis inhibition. Is it inhibiting cell membrane? What is it inhibiting? What is it inhibiting? Yes, you all are right. You all are right. The correct answer here is, what is the correct answer? The correct answer here is, it is inhibiting DHFR, dihydrofolate reductase. So that's why it is inhibiting folic acid synthesis. So it is inhibiting thymidine synthesis inhibition. So it is inhibiting DNA, not protein, not cell wall, not cell membrane. It is inhibiting DNA synthesis indirectly, not directly. So the correct answer here is A. You all are right. Very good. Well done. So coming on the third chapter. Coming on the third chapter is quinolones. So that is how we will complete chapter by chapter in the complete antimicrobials. We are having nearly 15 chapters. Done. So we have to do nearly 15 chapters. This is the third chapter. So third chapter, quinolones. Quinolones. You know quinolones. Why quinolones are known as quinolones? Because it contains quinolone ring. Benzene ring nahi, this is the quinolone ring. You can see this is the quinolone ring. This is a quinolone ring. So it contains quinolone ring in it. That's why known as quinolones. Initially, the first member is nalidixic acid. This is nalidixic acid. It contains only quinolone ring. Later on, we introduce fluorine. At carbon number 7, we are introducing fluorine in it. Fluorine. So it is known as fluoroquinolones. Can you see? Fluorine in it. It is known as fluoroquinolones. So this is the classification. This is the class. This is the old classification. Don't learn it. I'm telling you new classification. New classification. Okay, I will write it for you. There are 4 generations. First generation, second generation, third generation, and fourth generation. This is the classification. New classification in the new KDT. So that was old one. New one abhi recent aaya hai. So that is the classification. First, second, third, fourth. In first generation, only nalidixic acid is. Now, what is this generation? What is this first, second, third, fourth generation? It is a spectrum. We are improving the spectrum. Okay, let me tell you. So the first generation, which was coming first in the world, that was acting only against gram-negative bacteria. You know gram-negative. It was not killing gram-positive. And 2 members are there, nalidixic acid and oxanilic. Oxanilic nalidixic acid ka hi part hai, so you can see only one member nalidixic acid. It is killing only gram-negative, first generation. So we have improved it. We have improved it and we have created second generation. So it has expanded gram-negative. And with ग्राम पॉजिटिव तो अभी भी नहीं है, यहाँ पे लिमिटेड ग्राम नेगेटिव था, ग्राम नेगेटिव भी सारे नहीं थे, स्मॉल अमाउंट ऑफ ग्राम नेगेटिव वर किल्ड बाय नैलिडिक्सिक एसिड. यहाँ पे एक्सपांडेड ग्राम नेगेटिव तो पूरे मरेंगे कम से कम. यहाँ पे देयर आर नॉरफ्लॉक्स, देयर आर 4 ड्रग्स, नॉरफ्लॉक्स, लोमीफ्लॉक्स, ciproflox and oflox. There are 4 drugs in second generation NLCO. Norflox, lemiflox, ciproflox, oflox. Give me a thumbs up. NLCO. That is second generation. Coming on the third generation, it has expanded gram negative तो है ही है और थोड़ा बहुत gram positive को भी मारेगा. So we want such antibiotic which kill everyone, which kill all bacteria. तो gram negative तो expanded है, gram negative को थोड़ा बहुत मारेगा. तो यहाँ पे levoflox, starflox, sparflox, Gettyflox, T-flox, Timaflox, Tosuflox, and Moxiflox. Learn the mnemonic now. Make your own mnemonic and learn. So there are 1, 2, 3, 4, 5, 6, 7. 7 drugs are there. So learn these 7 drugs in the third generation. Coming on fourth and last generation. It has improved gram positivity along with gram negative also and anaerobic activity also. So it has the broadest spectrum. The best one are the fourth generation. So it is Trovaflox, it is Pleroflox, it is Gemiflox, it is Pruliflox, it is Sitaflox, and it is Clinlaflox. I know the names are difficult, but read again. 1, 2, 3, 4, 5, 6. Read again. You will come to know which generation में कौन सा आता है. Again, I will repeat it for you. There are 4 generations: first, second, third, and fourth. Let me tell you the spectrum in each of them. Based on spectrum, the classification is there. So based on the spectrum, first generation kills only gram negative, that is limited gram negative. The second kills extended gram negative. The third have extended gram negative with limited gram positive. The fourth has extended gram positive with anaerobic activity. So best are the fourth. Now don't expect कि मुझे सारे examples याद होंगे, मुझे नहीं है यार. To be very frank, फर्स्ट का मुझे याद है नैलिडिक्सिक एसिड है, सेकंड का मैंने अभी कुछ निमोनिक बनाया था ना, सो आई रियली डोंट नो. सो यू हैव टू लर्न. यहाँ पे 4 है, यहाँ पे 7 है, यहाँ पे 6 है. You have to learn the names. So frankly speaking, I am not remembering all the names right now, but if I try, I can do it. If I can do it at my age, of course you are younger and more energetic than me, you can of course do it. So please learn the names at least for the MCQ, that you can identify which generation में से कौन सा है. So Lemiflox कहाँ है, Starflox कहाँ है, Gemiflox कहाँ है, Getiflox कहाँ है, O-flox कहाँ है. So you should identify it. Give me a thumbs up. Give me a thumbs up. And being a doctor also, you should know ना कौन सा antibiotic कौन से बैक्टीरिया को मारेगा. So you should know the spectrum. So that is the classification. After the classification, let me move on the spectrum. As I have told you ना, spectrum भी यहीं पे cover हो गया ना, कौन सा किसको मारता है. Mechanism of action. They also inhibit DNA synthesis, but these are not indirect inhibitors. Like they will not inhibit folic acid synthesis. They will directly inhibit DNA synthesis. These are direct inhibitors. It is not like sulfonamide and trimethoprim. They indirectly inhibiting DNA synthesis by inhibiting folic acid. They will directly inhibit DNA synthesis. How they will inhibit DNA synthesis? Let me tell you. Okay, let me tell you. So this is a cell of the bacteria. This is the nucleus of the bacteria. Inside the nucleus, this is the DNA. DNA is double-stranded. DNA is always double-stranded. Now this bacteria wants to divide. This bacteria wants to do the cell division, and 2 daughter cells has to be formed from this. For that, this DNA has to be divided. Now, how this DNA division takes place? So first, this double-stranded DNA becomes unwinding. The first step, the 2 strands separate from each other. Unwinding is the first step. You have studied all this in biochemistry now. The next step, leading and lagging 2 strands are there. Then a duplicate complementary strand leading पे भी बनेगा, complementary lagging पे भी बनेगा. You know, and from 2 strands, 4 strands are formed, and they will go in 2 different daughter cells. Give me a thumbs up if you got it. What I mean? Okay, I will draw again. So this is a double-stranded bacteria. Double-stranded DNA. First, the 2 strands are separated. This step is known as unwinding. After unwinding, one is leading, one is lagging. So complementary strands are formed on leading also, on lagging also. And after that, the 2 strands are separated. 2 strands are separated. So from 2, 4 are formed. So in each bacteria, this will go in one daughter cell, this will go in other daughter cell. Give me a thumbs up. So what is the first step? First step is unwinding. Unwinding कैसे होती है? How does this unwinding takes place? Do you know what is unwinding? Do you know what is unwinding? This is double-stranded and this is unwinding. So first step is unwinding. For unwinding, enzyme is required. What is the name of that enzyme? The name of that enzyme is DNA gyrase. DNA gyrase in gram-negative bacteria and topoisomerase 4 in gram-positive bacteria. So that is the name of the enzyme. In gram-negative, it is DNA gyrase. In gram-positive, it is topoisomerase. Topoisomerase 4, I guess. Let me confirm, it is 4 only. Okay. So that is the bacteria, that is the enzyme which is required for unwinding. Unwinding होगा तभी तो आगे होगा ना. These are the drugs. Quinolones inhibit these enzymes. So quinolones inhibit DNA gyrase in gram-negative and topoisomerase 4 in gram-positive. So whenever this bacteria wants to divide, unwinding will not take place. Since unwinding cannot take place, so leading and lagging strand will not form. So DNA duplication will not take place. So they are inhibiting DNA duplication directly, DNA replication directly. Give me a thumbs up. Give me a thumbs up, everyone, if you like it. Give me a thumbs up. So yes, I was right. DNA gyrase in gram-negative and topoisomerase 4 in gram-positive. This is required for unwinding wala step, and fluoroquinolones inhibit this. Fluoroquinolones inhibit these enzymes in gram-negative and gram-positive. So normally कैसे होता है? You can see this is a double-stranded DNA, and it is doing unwinding here also. It is doing unwinding here also. The enzyme required is DNA gyrase in gram-negative and topoisomerase 2 नहीं, topoisomerase 4 in gram positive. Topoisomerase 2 humans में लगता है unwinding के लिए. It is not inhibiting topoisomerase 2. It is inhibiting topoisomerase 4. Done. So fluoroquinolones inhibit DNA gyrase. So actually this enzyme, let me draw again. Okay, so this is a double stranded DNA. For unwinding you require a, this is the unwinding. Unwinding is done by a enzyme. The name of the enzyme is DNA gyrase. Just for say it is a gram negative bacteria. So it is DNA gyrase. It has two subunits, subunit A and subunit B. So what does A and B are doing? How unwinding takes place? Actually subunit A comes, give a nick, nick, एक nick होगा वहां पे. Then subunit B comes, then it does the uncoiling or negative strands. ऐसा ऐसा लपेटा है तो उसको उल्टा उल्टा करना, दैट इज नेगेटिव सुपर कॉइल. B will give the negative supercoil and A after negative supercoil A again seal. So A का फंक्शन है सबयूनिट A का फंक्शन है निकिंग एंड रीसेलिंग और B का फंक्शन है, व्हाट इज द फंक्शन ऑफ B? A का फंक्शन है पहले निक देना और A का ही फंक्शन है बाद में रीसील करना. और B का फंक्शन है, तो सबयूनिट B का फंक्शन है उसमें नेगेटिव सुपरकॉइल इंट्रोड्यूस करके उसको सीधा करता जाना. गिव मी अ थम्स अप. सो हमारा फ्लोरोक्विनोलोन्स A को इनहिबिट करता है, B को इनहिबिट नहीं करता. फ्लोरोक्विनोलोन्स इनहिबिट करता है डीएनए गायरेज के सबयूनिट ए को. फ्लोरोक्विनोलोन्स इनहिबिट डीएनए गायरेज का सबयूनिट ए, सबयूनिट बी नहीं बीइंग स्पेसिफाइड. तो निकिंग और रीसीलिंग नहीं होगा तो अनवाइंडिंग नहीं होगा, अनवाइंडिंग नहीं होगा तो लीडिंग लैगिंग नहीं बनेगा, लीडिंग लैगिंग नहीं बनेगा तो आगे की स्टोरी एंड. गिव मी अ थम्स अप. डीएनए डुप्लीकेशन नहीं होगा. गिव मी अ थम्स अप. सो फ्लोरोक्विनोलोन्स इनहिबिट सबयूनिट ए ऑफ डीएनए गायरेज. So cutting and resealing function will not take place. So unwinding will not take place. So DNA duplication will not take place. Everyone give me a thumbs up. I want only one thumbs up from Khushi. What others are doing? Everyone give me a thumbs up. Everyone give me a thumbs up. What are the adverse effects? There is no mnemonic for the adverse effects. You can learn like GIT में nausea, vomiting, CNS में headache, dizziness, bone soft tissue में it causes tendinitis and rupture of the tendon. So it is contraindicated in children. That's why it is contraindicated in children. Phototoxicity is caused. In the heart, torsades de pointus is caused and they are teratogenic. So you have to learn the side effects by your own. There is no mnemonic. I don't have any. Mnemonic for users I am having. The mnemonic is 4G, spectrum CT. 4G. What are 4G? 4G is gonorrhea. We give them in gonorrhea, gastroenteritis, gynecological infections and gram negative. The fourth generation are active again gram positive also, gram negative also, anaerobic also. So we can give fourth generation in any infection. कुछ भी infection है fourth generation दे दो, कुछ ना कुछ तो होगा ही ना, उस पे काम करेगा ही. So that is the broadest spectrum. So 4G are gonorrhea, gastroenteritis, gynecological infection and gram negative. Spectrum का S stands for septicemia. P stands for prophylaxis. For prophylaxis before surgery we use this. E for enterocolitis, C for chancroid, T for typhoid, R for RTI, U for UTI, M for meningitis. RTI respiratory tract infection, UTI urinary tract infection, T for conjunctivitis and T for tuberculosis. Give me a thumbs up. Everyone give me a thumbs up. Everyone. So that is 4G spectrum CT. Say the full form again and again. So I'm done with this chapter. Now after that one-liners are there. If you wish for your MCQs, you should learn one-liners in the end. After uses and adverse effect, you should know the one-liners. Which is most potent among the first generation? It is ciproflox. Which is least potent among them is norflox. Which is readily absorbed but food delays the absorption. It is ciproflox. So likewise there are many one-liners. Most highest bioavailability, least bioavailability. इन दोनों पे MCQ है past papers में. Highest पे है FMG में पूछा जा चुका है. It is levoflox. 100% bioavailability. Least bioavailability norflox. So highest plasma concentration, highest first pass mechanism, longest acting. You should learn it. You should. I'm not saying one by one. You should learn it. It is your wish if you want to learn it. These are the one-liners. These are the one-liners. You should learn it. I'm done with the third chapter also. I'm done with the third chapter also. The 3 chapters are in front of you. Do the comparison. I have really done a hard work to make this table. Today morning only before class I make this table for you people. I think this will be a better way of teaching you. So instead of asking you to make table, I thought I will make table for you and show it to you so that you will get stimulated and by seeing my table you will make your own. So that's why I have made this table for you. So see this table and please read it. So let me tell you the third chapter, the last chapter, quinolones. So quinolones, they have quinolone ring. That's why known as quinolones, and at carbon number 7 they have fluorine. That's why known as fluoroquinolones. 1, 2, 3, 4 generation you already know. One generation only gram negative limited. Second is extended gram negative. Third along with gram negative, gram positive but limited. Fourth, gram negative also, gram positive also, anaerobic also. And in each of them, learn the drugs. Learn the drugs. And spectrum, that already I have told you. This thing only I have written here also. Mechanism of action, it is inhibiting two enzymes. Name that enzymes. Name that. If it is gram negative bacteria, it is DNA gyrase. And if it is gram positive bacteria, it is gram positive कर लो उसको. It is topoisomerase. Give me a thumbs up, topoisomerase 4. And this bacteria is required for unwinding step during DNA replication. And which fragment of this bacteria? Fragment number A, not fragment number B. So unwinding will not take place, DNA duplication will not take place, DNA replication will not take place. What are the adverse effect? Adverse effect के लिए I don't have any mnemonic, but you have to learn. What is the uses? Uses का mnemonic is 4G spectrum CT. Say the full form. You already know the full form. Uses, कंपेयर करो तीनों के. साइड इफेक्ट कंपेयर करो. मोस्ट ऑफ द क्वेश्चंस एमसीक्यूज आर फ्रॉम यूजर्स, साइड इफेक्ट और मैकेनिज्म ऑफ एक्शन. सो दीज थ्री हेडिंग्स शुड बी एट द टिप ऑफ योर टंग. मैकेनिज्म ऑफ एक्शन के लिए एंजाइम ऑफ ईच ऑफ देम, uses and side effect in mnemonics. You have to learn, you have to learn. Include all these table in your golden notebook, for your last day revisions, done. So one liners you have to learn, Bhuvi. Done. Okay, Bhuvi, I will send the PDF of last notes. Many students are asking for it. So last notes ka PDF I will send on the social media, on WhatsApp or Telegram only I can send it. Can't send on the Insta. So I will send you on the WhatsApp and Telegram. Those who are my followers on WhatsApp and Telegram, they can see it from there. So this notes also I will try to send. I will try. The size is big actually, but I will cut the PPT in multiple portion and send it to you. Don't worry. Okay, so these are the one liners you have to learn. There is no escape. So the one which is having highest CSF concentration is P-flox. Highest oral availability is levoflox. Least oral availability is norflox. Maximum plasma binding is sparflox. Highest first pass is P-flox. Longest acting is starflox. You have to learn. You have to learn it. Huh? And what about phototoxicity? Learn it. Phototoxicity, L followed by S followed by P. These three are phototoxic. If you take any of these tablets and go in the sun, there will be phototoxicity by the sun on the skin. So what is L? Lomiflox, followed by sparflox, followed by P-flox. Many MCQs are asked in the past on this concept. LSP. You have to learn LSP for phototoxicity wala side effect. So phototoxicity wala side effect is LSP. What is the excretion? Excretion is by non-renal mechanism, by renal mechanism, and 50-50 by non-renal and renal. So you have to learn the drugs. Which drugs are excreted by non-renal mechanism? That is in feces. Which drugs are excreted by renal mechanism? That is in urine. And which drug is 50-50% excreted in feces and in urine? So the name of the drug which is 50-50% is Sparflox. Sparflox is 50-50% both. So you have to learn. These drugs are withdrawn from the market. These are banned nowadays. These are not used. These are banned. These are banned from the market because of the side effects. Because you have to learn this. What is the reason for banning? For MCQs. Temoflox for immune hemolytic anemia. Grapaflox is cardiotoxicity. Trovaflox is hepatotoxicity. Clinaflox is phototoxicity. And Getiflox is banned recently in India. I have prescribed this to my some patients initially when I was in MBBS days, many years back, but nowadays it is not available due to the risk of hyperglycemia and elderly. Diabetic patient को नहीं दे सकते हैं. So these 5 drugs are floxacins, quinolones, which are banned from India, banned from the world because of their particular side effects. So learn these one-liners. Learn it for MCQs. I am done. Everyone give me a thumbs up. I tried hard. Do you want MCQs for quinolones? The third chapter के MCQs करने हैं क्या? Polls करने हैं क्या? Say yes. You have to write the answer in the chat box fast. So this is the first question in front of you. Be fast. Fluoroquinolones or quinolones, one and the same thing. Fluoroquinolones mechanism of action in gram-positive bacteria. Please read the question. Question has a clench. I'm asking about gram-positive bacteria. The 4 options are in front of you. DNA gyrase, topoisomerase 2, topoisomerase 3, topoisomerase 4. I'm asking for gram-positive bacteria. What is the correct answer? ABCD is in front of you. Who will tell me the correct answer? Be fast. You can't be slow. Be fast. What is the correct answer? I can't see your answer yet. Yes, Khushi, what is your answer? So most of you are saying the answer is D. You all are right. Very good. It is topoisomerase 4 and gram positive. Instead of gram positive, if I say gram negative, what will be your answer then in that scenario? Gram negative wala pooch liya, same question, same options. If instead of gram positive, I ask for gram negative, what will be your answer in that scenario? In that scenario, you all are right. In that scenario, your answer will be A. So depending on the question, don't rush. ये नहीं कि fluoroquinolone पढ़ते से answer tick करना है. No, in exam you get hyper excited. Oh, fluoroquinolone is my favorite topic. Oh, answer is DNA gyrase. No, just read the full question. They are not asking in gram negative. They are asking gram positive. So answer is not DNA gyrase. It is topoisomerase 4. Don't get hyper excited. Read all the question completely. Read all 4 options before taking your answer. It happens in the exam. That's why I'm telling you. Correct answer here is D. You all are right. This is the next question in front of you. Which of the following fluoroquinolones have broadest spectrum? Broadest means fourth generation में से कौन है? Now learn the classification. I don't know the classification, but yeah, from the options I can make it out कि fourth generation में से कौन होगा. So it is ciproflox, norflox, trovaflox और naledixian. Naledixian is the first generation. तो ये तो हटा दो. First generation से है. Fourth generation में से कौन है? वो broadest होगा. वो broadest होगा. So it is trovaflox, I guess. It should be trovaflox, which is from fourth generation, because cipro and nor are from the second or third generation. They are from second or third. I have to check. So I don't know the exact classification, but from the options I can make it out for which drug is from which generation. So that is how you have to do. So correct answer here is C. Yes, you all are right. The correct answer here is C. So these are the fourth generation. From the fourth generation, it is Trova. You can see Trova, Flero, Gami, Truly, Sita, and Clina. These are floxacins. Floxacin to suffix hai. Floxacin is the suffix for all of them. Learn the prefix. Learn the prefix for doing the MCQs. So it is Trova. Next question. Which of the following is having least oral? It is oral, huh? Typing mistake. It is oral bioavailability. Least oral. Least. I'm not asking most. It is already asked in your past papers of FMG. Least oral. One liners में मैंने बताया था. One liners में मैंने बताया था. Which of the following is having least oral bioavailability? Yes. Who will tell me the correct answer? Who will tell me the correct answer? The 4 options are in front of you. Is it Norflox? Is it Oflox? Is it Ciproflox? Is it Levoflox? What is the correct answer? Yes, most of you are correct. Yes, the correct answer here is Norflox. Norflox is having least and Levoflox is having most. So in the question, least is asked. If instead of least, if I say most, which of the following is having most or maximum bioavailability, your answer will become D. So depending on the question, you have to mark your answers. So you should know most wala bhi, least wala bhi. Most वाला Levoflox है 100% bioavailability, least वाला Norflox है only 35% bioavailability. Have you got it? Have you got it? Highest photosensitivity. I have told you the order also. Photosensitivity का LSP was the order, I guess. LSP was the order. Highest पूछ रही हूँ मैं. 3 options are correct. तो L भी कराता है, S भी कराता है, P भी कराता है. ये तीनों photosensitivity कराते हैं. But question में highest पूछा है. तो highest है तो I will go with L. So the correct answer here is C, because this is the sequence. I have told you the sequence for photosensitivity. So highest is this, और highest की जगह lowest होता question में, तो my answer was P flox. So depending on the question you have to answer. Again I will say done. So this is how in the one liners it is given. So this is the order. LSP. One liners are really important. So LSP. LSP. So what is the full form of LSP? Lomiflox, Parflox, P-flox. Lomi, Par, P. All these 3 cause photosensitivity. So that is the order. And in the exam, don't get hyper excited. Highest पढ़ाई नहीं तुमने और photosensitivity. Yes, photosensitivity. I know the answer और P-flox mark कर दिया. No, just read the question. Read the question again and again. I will say. Next question. Drug which is withdrawn from India. Which of the following drug is withdrawn from India? I have given you the list of the drugs which are withdrawn from the quinolones. 5 of the quinolones are withdrawn from the India along with their reasons. I have told you along with the reasons. So Levoflox, no, Levoflox तो मैंने ही कितनी बार लिया है. Gatiflox, Moxiflox और Oflox. Oflox भी हम लोग लेते रहते हैं ना. Moxi भी हम लोग बच्चों में देते हैं Moxiflox. In pediatric we give this Moxiflox. Gatiflox is withdrawn. I remember this Gatiflox because I have prescribed to very close one in my MBBS days. But after that it was withdrawn from the market. So Gatiflox is withdrawn because of risk of hyperglycemia. We can't give it in diabetic patient and elderly patient. Severe hyperglycemia is there. So Gatiflox. So correct answer here is B. So these are the 4 antibiotics apart from Gati. Gati to hai. Answer यहाँ पे B है. These are also withdrawn apart from Gati. So Tima, Grepa, Trova and Clina. Tima for hemolytic anemia, Grepa for cardio, Trova for hepato, and Clina for poto. And apart from it is Gati. Gati is for hyperglycemia. Learn 5 drugs which are withdrawn or banned. This is the next question in front of you. Which of the following is not excreted by kidney? So non-renal वाला mechanism बताओ. मैंने excretion बताया ना. Non-renal की भी list बताई. रीनल की भी लिस्ट बताई और 50-50% का एक ही ड्रग बताया स्पारफ्लॉक्स, which is 50% renal and 50% non-renal. इन दोनों की लंबी लंबी लिस्ट थी. You have to learn that list. You can see the question is already asked in the past year papers. So which of the following is not excreted? So I'm asking about non-renal. Non-renal में से कौन है? Frankly speaking, I don't learn that list. मुझे याद नहीं है, so I will see the answer and show you the list. So the correct answer here is D. D is moxiflox. I will see. So moxiflox is there in non-renal mechanism. Okay, I will mark it for you and read it for you. This is non-renal, this is renal, and this is 50-50 renal and non-renal. So we will read the drugs once. Okay. So non-renal में there are 5 drugs. What are the 5 drugs? Nalidixic acid, Trova, which is withdrawn, Grapo, which is withdrawn, P-flox, which causes photosensitivity, and Moxiflox, which is given in pediatric population. These 5 are non-renal. Renal में it is a big list. Cipro, Clina, Gatti, Levo, Lome, Oflox, you can see. And 50-50 में only one drug is there, Sparflox. So learn it, learn it, learn it, learn it. It's your days of learning, not my days. I have already cracked my exams multiple times. I had given my exams starting from pre-final year. I have cracked it in pre-final year, final year, then internship. So I have cracked multiple exams in the 3 years. Yes. So it's your days now. You have to crack it now. You have to crack this time now. This time. Yes. So it's your days. तुम्हें learn करना है. मैंने तो बहुत कर लिया. Done. So तुम्हें learn करना है. I will guide you कैसे करना है. लेकिन मेहनत तो तुम्हें ही करनी पड़ेगी. Done. Okay. So I'm done. I'm done with the 3 chapters. So the next 4 chapters, protein synthesis inhibitors. These are the protein synthesis inhibitors. 6 plus 4, total 10 drugs are there. These are minor, जो मैं बहुत short में पढ़ाऊंगी. I will teach you in very short. In the end, these are 4 major. So I ask you to make a comparative table of these 4 major: tetracycline, chloramphenicol, aminoglycoside, and macrolide. So these are the four major drugs. Just a second, I ask you to make this table. Okay, yeah, this table. So we will fill this table now. We will fill. So first I will teach you tetracycline in the same headings. Then second chapter chloramphenicol. Third chapter aminoglycoside. And fourth chapter erythromycin. One by one we will complete chapter. And we will do MCQs polls based on that chapter. 4 chapter ये 3 वो total 7 chapters हो जाएंगे. But you know the time is limited. I can't start. If I start it, I can do only 1. The rest 3 will be remaining. So I don't want to start it and leave it in the between only. I want to complete all these 4 in one shot. So tomorrow will be the day when I will complete these 4 in one shot, and after that I will start with some small drugs, some penicillins. Yeah, of course, penicillins. So these 4 plus penicillins will be done tomorrow. So tomorrow I will continue it. Don't worry. Just give me 1 minute. I want to announce my next lecture. After that, you people can quit. I'm sorry. Okay.